Well, good morning and or afternoon to everyone, depending on where you are. It's so exciting to see all of you here. It's great to see so many familiar names and a couple of faces in the pictures below. It's great to have you here today to just kind of come together and get another perspective on what's going on around us. My name is Mike Shires. I'm the Associate Dean for Strategy and Special Projects at the Pepperdine School of Public Policy. It is my distinct privilege to entertain you all today and to interview our guest speaker today. I just want to take a moment and thank all of you for joining us. One of the privileges of being a part of the Pepperdine community is just to see so many friends and some new faces and names as well. So thank you very much for joining us. Our conversation today is part of Pepperdine's, the Pepperdine School of Public Policy's activities and events. We decided, since we couldn't host our normal events where we bring you to people, that we would go online and bring some folks to you. And so today is another part of that series. For those of you interested in seeing what other things we have going on, you can go to publicpolicy.pepperdine.edu, public policy all one word, /events, and see the upcoming events we have going on. One of the special things about being a professor at the Pepperdine School of Public Policy is getting to teach an extraordinary group of young men and women, and I guess some not so young ones as well. It's just an amazing group of folks who really go off and change the world around them. And as I look at the list of names on the screen, I see many of our alumni and exciting places serving the public in these difficult times. And part of what's going on around us right now is very hard. And one of the best things about Pepperdine, and I encourage you to reach out to the community, is that it's a family. And so we are here to support each other and to support you. One of the things that we want to do today is just kind of get some perspective on what's going on. I've been at Pepperdine now for 20 years, teaching students who've gone through our program. And our guest today, actually, I had the privilege of teaching almost a decade ago now. Time goes quickly, I guess. And just seeing these students go off and really transform their communities and their countries. And so I don't want to take up too much time in introduction, so let me just move on to kind of our program for today. Our guest today is David Mansdoerfer, who graduated from the School of Public Policy in 2011. He currently serves as the special assistant to the president at the University of North Texas Health Science Center. He oversees brand and communications and advancement there. He is currently, I'm sure, very busy as the incident commander for the COVID-19 response for the center. And one of his big projects up until this, and this is actually what we were probably talking with him about today if the pandemic hadn't rolled upon us, is he's been instrumental in advancing work not only here, but also at his former employer, which I'll talk about in a second, in responding to the opioid crisis and the opioid, what we used to call the opioid pandemic. I think COVID certainly has given us a perspective on the scale of the impact on communities. And in fact, the opioid crisis is very comparable in scale and magnitude, if not more so. But more interesting, I think, to today's conversation, up until August of last year, David served as, I'm going to look at my notes here because there's a long title, Deputy Assistant Secretary for Health and Acting Principal Deputy Assistant Secretary for Administration, the Director of Boards and Commissions, and the Chief Labor Negotiator for the United States Department of Health and Human Services. And so HHS obviously is a critical actor in the midst of all we're involved with today. And he had the operational responsibility for the agency. And so at HHS, his responsibilities included not only his office, but also coordinating the offices of HIV and infectious disease, human research protection, the Office of the Surgeon General, Public Health Commission Corps, Minority Health, Women's Health, and Disease Prevention and Health Promotion. So as you can see, a broad scope of issues. And what's, I think, particularly insightful is that, we often thought of national security as the Department of Defense. And almost all of our thinking about national security was really focused there. But what we've seen in the face of the COVID pandemic is that in fact, health policy is a major part of national defense as well. And whereas before HHS's role was primarily seen as making sure that the major health and support programs in our society were being funded and funds were being distributed appropriately for things like Medicare and Medicaid and the healthcare rollout. In fact, now they are a central part of our national security strategy. And so what I would love to do to start our conversation with David, and I want to welcome you to our conversation, is to just ask you to just spend a couple minutes talking about what your role was at the agency and some of the things that you did there.
Absolutely. Well, thanks for the introduction. Well, to start off, so I was appointed by the president in February of 2017 to join the team at HHS. So to get an understanding of, and I don't know how much everyone knows about presidential transitions, essentially, as of effective 11:59 on January 20th, all of the leadership leaves from a previous administration, and then 12:01, the new administration, they're called landing teams, hit every one of the federal agencies. And typically those teams are between 25 and 30 people, and they're really tasked with starting the transition plan to build and manage federal departments. There's probably nothing much like that in terms of a private sector. I mean, you can think about it in terms of, imagine one day at Amazon, they fired all of the managers, and then the next day they hired all brand new managers and told them that they couldn't talk to the last managers, or the last managers didn't want to talk to them. So imagine that. And then that's kind of the transitionary period that I came on with at HHS. HHS, at the beginning, I was part of the team that hired a good contingent of the first round of political appointees. And for everyone, just to give you a baseline, HHS oversees multiple components. It's a $1.2 trillion agency. It spans from CMS, or the Centers for Medicaid and Medicare, FDA, NIH, CDC. You have SAMHSA, which is mental health. And you have ASPR, which is a big portion of this conversation that resides in the Office of the Secretary, and that's the Assistant Secretary for Preparedness and Response. HHS also has a uniform service that it oversees that I had the pleasure of helping oversee when I was there, and that's the Public Health Commission Corps. That is a 6,500 unit uniform service that oversees disaster responses, everything from hurricanes, disaster management assistant teams. So those are the med teams you see sometimes transitioned out into the places like Houston and Puerto Rico when you have hurricanes. We also handled Ebola responses, whether it's over in Africa or when it transitioned here to the United States. So that was a good contingent of my first part of HHS. I transitioned to working for the Office of the Assistant Secretary for Health, which oversaw many of the offices that Dr. Shires listed, from the disease infection, HIV and infectious diseases, National Vaccine Program, Women's Health, Minority Health. It oversaw the Common Rule, which has actually come into a little bit of play here with the pandemic. Common Rule oversees kind of human research protection issues. And so I had the opportunity to oversee and work with Dr. Giroir. Many of you may know Dr. Giroir as he's the point on testing nationwide right now. He's also working with Dr. Tammy Beckham, who's the point on kind of the diagnostic side. So Dr. Beckham runs our Office of Infectious Diseases. Dr. Giroir is the Assistant Secretary for Health, and he's the one you see at the podium most days at the president's briefing, as he's really overseeing kind of a three-part plan to roll out testing nationwide. Other contingents of my job, just to provide the baseline, were the acting assistant, principal deputy assistant secretary for administration. That specifically oversees the contracting side and HR side of HHS. And then and if anyone's on from my former Morlock office, because I had some understanding of labor relations, they tasked me with overseeing labor relations for the department as well too, including contract negotiations with our labor teams. So kind of all that, when you're a political appointee, you kind of just get tasked with doing whatever they need you to do. And so, most of us there are about 170 political appointees at HHS at any given time, tend to run with 2 or 3 jobs at a time.
Wow, it doesn't sound like you slept very much in that cycle.
No.
since you were recently there, you know most of the actors that are in play right now and the folks who are doing this. We'd love to get your insights on some of the internal politics. Just things like who's in charge, and part of it is why does it seem so chaotic as this is unfolded? What's really driven those changes and transitions?
Absolutely. So, kind of to track through how it started and how it's kind of ended up where it is today. So, Secretary Azar, who many of you all remember as former Eli Lilly president, great business background, was the former Deputy Secretary and General Counsel for Bush 43. He's the Secretary of HHS right now, and he's really well positioned and was well positioned to lead the response to COVID-19, because again, a lot of the components that I talked about from FDA to NIH and CDC are really key players in it. But when this began to turn into more of a nationwide, large-scale infrastructure issue, that probably brought on the need specifically for it to transition to the White House. Think about presidential transitions, and essentially you're hiring government-wide about 4,500 political appointees that have generally never worked well together or worked together at all. And most of them are very type A. Most of them are very good at what they do. And imagine having someone from HHS telling someone from DOD what needed to happen. That's why the White House needed to step in. That's why Vice President Pence needed to step in. Not because Secretary Azar had done anything specifically, but because of the need to coordinate a government-wide response, and having orders come down from the commander-in-chief in the White House is sometimes easier, especially when there's a fluency level that HHS may not have with DOD or other places. So you've seen kind of a transition to a White House command and control structure. It's being run predominantly by the vice president and out of his office. He's brought on several folks that have basically coordinated. One I've mentioned before is my former boss, Dr. and Admiral Brett Giroir. He is overseeing the testing side. Ambassador Birx from the State Department is overseeing really kind of the public health component. Dr. Fauci, who many of you have seen, is the NIH infectious disease head of the Agency for Infectious Diseases. So he is running kind of the disease component side. And really, all in all, it's been a kind of whole of government response. And that's been necessary because you've had to incorporate things like the Treasury, the Commerce Department, Small Business Administration, things that a Secretary Azar doesn't have the fluency in that maybe the White House does. So I think it's been a good transition to having the White House really run this and coordinate, as opposed to maybe having traditionally what should have been maybe an HHS and FEMA approach.
Now, there's so many agencies that are central to this. I mean, you mentioned NIH, CDC, FDA. In terms of the dynamics inside of this, is it very collaborative, or is there a sense of competition? I mean, you have a better read on the personalities and the mechanics of how this works. I know typically, agencies are competing for budgets, and it tends to be a competitive environment. But have you seen that unfold in the face of this crisis?
Well, what's really interesting about that is that, there are a lot of kind of intrapersonal and inter-office dynamics, especially when you have an agency that's $1.2 trillion. I think you can read historically about FDA and all of its commissioners' approach to thinking it should be its own separate agency. I think you could make the same argument for CDC and NIH and how they sometimes look at themselves. So kind of knowing that, in this, it was kind of an interesting exercise because CDC got a lot of flack for the testing rollout, specifically at the front end. Now, there were some issues that you may think about could have been done better. They tried to plus up and add a little complexity to the test from the World Health Organization, and that didn't roll out very well. And I think that was very highly publicized. But what wasn't as highly publicized is that CDC test is essentially regulated by FDA. So FDA regulates who can test and under what thresholds you can test for. So you have the emergency use. You also have CLIA, C-L-I-A. I won't get into those definitions or laws, but essentially those govern the diagnostic testing side. And essentially FDA authorized CDC and CDC alone to run testing. And also historically, when you look at the public health declaration, a public health emergency, that actually really helps ramp up the vaccines and the therapeutic side, but it also sometimes makes life more difficult on the diagnostic side. So you had some interesting interpersonal dynamics between FDA and CDC. CDC, I think, could have done better with the testing, but FDA designating CDC as its only testing source definitely slowed things down as well too. And there are lots of good documents that you can read out there specifically about that relationship. But one of the good things that the president and the vice president and Secretary Azar have done is kind of eliminated those hurdles, kind of granted broad emergency use authority on the diagnostic and testing side, as long as it's scientifically validated, and continue to move forward on kind of breaking down a lot of the barriers from the different types of testing, whether it's the serology testing, that's kind of whether you had the disease, or whether it's you have symptoms and we want to know if you have the disease right now.
So it's such a complicated landscape. You'd mentioned the whole of government approach. And I mean, I'm a little bit curious about how well you see that working. I mean, clearly the task force is taking the lead on it. Are there areas where we need that to go stronger, or do you think that it's actually working about as well as you can under the kind of combat conditions we're under?
It's one of those things that I think they're learning and growing as you go. I think early on, there were a lot of deficiencies that no one recognized or realized, and I don't think any administration could have really mitigated a lot on the front end. But one of the great things of having someone like a Secretary Azar or President Trump is that they're business and outcomes oriented. So they tend to focus on getting something from A to Z. I know the Secretary Azar all had us read the book, 4 Disciplines of Execution. And that's it's a management book. It's basically how he runs the department. And really that focuses on getting something from X to Y and when, and ignoring the whirlwind that basically draws you away from trying to achieve your goals. So having folks that are as outcome oriented as the president and the secretary is very beneficial in times like this. I think you've been able to see them move mountains. Right now, at least what Dr. Giroir mentioned yesterday, is that we're testing in terms of total numbers and per capita well above anywhere else in the world. And that's what's actually going to end up helping us reopen the world and reopen the, essentially the economy, is that ability to test, track and trace, and do that in a way where we feel comfortable.
Cool. You had also mentioned, I mean, one of the things about the School of Public Policy that we really emphasize is that public policy is about public, and it doesn't just include government. And that, the nonprofit community and especially the private sector play important roles in responding to policy problems. And, just like there's the whole of government part of this, I know the administration has been talking a lot about the private sector. Who is kind of overseeing the efforts, I guess, to coordinate the private sector response to all this?
Well, I mean, at least on appearances, it looks like Jared Kushner is doing a good significant portion of that. And Jared, who I had the opportunity to work with a couple of times, I worked with Ivanka more on health-related issues than I worked with Jared. But Jared did and has a good track record in understanding and working with some of the private sector companies that are really helping move the needle forward, whether it's McKesson or 3M or some of the big manufacturing companies. I would recommend everyone look specifically at some of the commentary that Governor Cuomo talked about in New York about how Jared was able to help move necessary goods and PPE, or personal protective equipment, to make sure that they could address some of the severe shortages that they saw in New York. So having someone and having a president that has a significant background in public health, not public health, but in business, helps drive that mindset forward in a way that I don't think other administrations have necessarily had that ability or that mindset.
So I want to shift a little bit, since we have access to you and since you're not part of the administration, so you can tell us what you think, kind of on the politics of this. And as I move there, I want to point out one of our goals today is to kind of keep this part of the conversation modestly short so that we have time to take questions from the audience. And so if there's anybody who'd like to submit questions, you'll see me glancing down every so often. If you go to the chat window at the bottom of the screen, you can type your question in there, and I'll be looking for those and looking to pick some questions out of there. So as we wind up, I mean, we're going to talk about politics for a little bit now, and then we'll open the floor for questions. So if you folks are waiting for an invitation for questions, certainly this is it. Um, let's talk a little bit about the politics. There was we've already talked a little bit about the testing and some of the issues there, and some of the challenges that the FDA and the CDC had in terms of testing. Was it really as bad as the reporting said it was?
I think there was definite room for improvements, and I'm obviously, having been part and worked with many of the folks involved in this, I'm not going to be overly critical, and I'm probably a little biased in shading towards some of the good work that they're doing, but there was a lot of room for improvement. When I talked about CDC and their rollouts with both the reagents and also kind of what the complexities of the tests as opposed to maybe what the World Health Organization was doing, I think there was a lot of room for improvement there. And then the FDA basically only designating CDC as the testing at the beginning, that also made it difficult, especially when you had some failures on the CDC tests. And then I don't think necessarily what we all understood is that the public health declaration of emergency was going to be as impactful on making it difficult on the diagnostic side in the same way that it added value maybe on the vaccine and the therapeutic side. It made it equally as difficult on basically requiring the local labs to get emergency use authorizations, which basically limited their ability to test and roll out their own kits quickly, because that emergency use authorization, and I'll have to go back and I don't know, but this sounds very federal government, is to get an emergency use authorization, you essentially have to mail a hard copy and also mail a CD at the same time. So, having to go through an entire kind of long process of mailing your application in conjunction with doing it electronically is just, there's some inefficiencies that I think you see in government that probably wouldn't exist in the private sector, because, at this point, why you need it three different ways doesn't make much sense.
Yeah, I found it fascinating. I mean, there's been so much focus on testing, and apparently, many of the early tests had really bad results. And so, sometimes bad testing is more dangerous than not having any at all in terms of how you respond to things. Are there other parts of the response that you think could have been done better? I mean, one of my favorite quotes from the military is, a battle plan is only as good as the first engagement. And and then it all disappears, right? All your plans become new plans. But I guess as we look forward through this, are there areas where we could still be doing better right now, even as this is unfolding?
Well, I think what's interesting now is that you're starting to see, and I think this, you're starting to see a large consumer behavior change from how life was before to how life is going to be afterwards. And there's a lot of difficulty when you think about, well, if I'm a local restaurant or I'm a local mall or I am a large big box retail chain, what does life look like afterward? And what is the government, whether it's the local public health authority, whether it's the state, whether it's government, what are require me to do to get to that point in the future? So you almost have like a kind of an inverse bell curve where you had life as normal. You saw a huge dip in kind of consumer confidence and maybe going out and walking about and living a normal life. And now we're all sitting here at the bottom trying to figure out how we get back to the top. And from a business perspective, I read a very interesting article on ESPN the other day that 73% of folks today in a poll said they would not go to a sporting event until a vaccine is created. That's a very interesting and high number when you consider, less than 6, 7, 8 weeks ago, and that number probably would have been in the low tens, or even lower than that. And when you consider that a vaccine is probably, everyone says 12 to 18 months. My guess is probably somewhere between 9 and 12 to 9 and 15 months, just because you have so much time and effort dedicated to this right now, and the big players like Gilead and some of the Johnson & Johnson, they're dedicating a lot of time and resources. And sidebar a little bit on that one, that's actually really good because they're actually manufacturing the vaccine even before approval. So Johnson and Johnson came out and said by 2021, you could have enough vaccine to be able to do a significant portion of the population. And the only way they can do that is essentially have manufacture it at risk at the same time they're running approvals. So I think in terms of what could be better, it's actually more of an onus on state and local government because the federal government will kind of control the large picture, but what each state and locality, I mean, think about your county health organizations that deal with restaurants. All of those rules are going to be pretty different, come 6, 7, 8 weeks from now. And that's not even begin to start communicating. So I think you're going to need a huge communication effort on how to convince a consumer population that you've essentially scared to death to leave their house to feel comfortable to go back out into a community and live life in a way that consumer behavior makes sense again.
Yeah, I mean, I was talking to a friend of mine who's in the restaurant business, and he posed a very simple question. If you maintain social distancing in restaurants, that means you're reducing their restaurant space by 30 or 40%, and that's revenues.
Yeah.
And there aren't very many revenues that are running 30% profits right now that could afford to operate normally under those conditions. I mean, that kind of leads to this whole question of rollout and trying to get back to normal. I mean, what do you see as kind of the 2 or 3 big steps we have to accomplish to get there?
The first step is, and I would move you all to read the president's announcement yesterday that talked about who he's included on his advisory council to reopen. I call it the Reopening the World Council, but it's essentially an advisory council, which is essentially your major event players, whether it's the sports, it's your major retail associations, it's organized labor and some of the labor force and workforce issues. So you're going to have a pretty kind of broad plan that comes out, but really, in all honesty, and I'm going to get a little public health technical here, tracking and tracing is the most important part of this. Our ability to understand where outbreaks in the second wave is going to happen. And that's going to include both the serology side, which is understanding if we have a significant portion of the population who has gotten this. Because again, remember, the data around this is so poor, we don't know if you've had it, if you haven't had it, unless you've tested positive or tested negative. And to this point, we just don't have large enough data sizes to understand that, though we're quickly getting there. I mean, I think they're rolling out 1 million kits a week and testing about 1 million people a week. So tracking and tracing is going to be paramount, and that's really your county and your state local health departments. Their ability, they essentially guess anywhere between the range of 5 to 7 people for every positive test that they've had contact and had basically could have transmitted to 5 to 7 other people, and the ability to trace those people, investigate it, close it, and quarantine, and also test them as well too, is going to be tantamount to opening kind of the world back up. It's also going to come in phases. You're going to see it be a trickle effect where they open slowly. Because what's likely with diseases like this is that it will end up having a second and third wave, likely come late summer or early fall. But by that point, hopefully we'll have better therapeutic understanding, whether it's the Gilead drug on Ebola, whether it's the hydroxychloroquine, which we've all heard about multiple times, and the plasma, which is being pushed now, the antibodies from plasma that they're taking out of people who have already been through it. So I think once you get better therapeutics and then the ability to trace, track, and quarantine quickly small portions of the population, that's really what it's going to take.
You mentioned local governments in that conversation, and I just kind of want to take a second, from someone who's been on the federal side of this, what do you see as the federal government's role in this in terms of building leadership and all those all the ancillary issues that go with coordinating a national response?
I think the goal is when you have this kind of disjointed government organizational structure from the city, the county, the state, and the federal government. And luckily, I've had a chance to work for most of those by this point in my career, having worked in Orange County or the County of Orange, the California State Senate, in my city of Mission Viejo before I went to HHS. it's really going to take leadership, and it's going to take an understanding of what works and follow the science, but also understand what we're necessarily losing from a civil liberties side as well too, because I think that's a big portion that you're starting to see pop up, whether it's the ability to hold religious services. I know that's been especially visible out in California, whether it's tracking and tracing people, whether it's their phones or against their will, or how privacy comes into all of this as well too. You're going to see different organizational units try different priorities, and it'll fall all along the kind of government and the ideological spectrum, where you're going to have some civil liberties over here that tend to think, hey, as long as we track and trace and kind of get it open, we should go back to the free market. And then you're going to really have, I'll call them the government interventionist folks over here, who will focus specifically on how we conform people to live a new lifestyle afterwards, whether it's additional social distancing, whether it's, losing of some personal liberties, like, requiring tracing and tracking, mandated tracing and tracking. There's a lot of things that could come out of this. And I think it's a really interesting question, especially as we head into the 2020 season, of, whether people are going to repudiate essentially the loss of civil liberties that has happened because of this, and whether they'll see that as a public good or for the public benefit.
Yeah, I mean, it strikes me that in times of danger, post 9/11, during war, and in the midst of this pandemic, people have been quick to relinquish a lot of their cherished rights and freedoms. And it'll be interesting to see how it unfolds as they try and reclaim those. I wanted to turn to one of the questions here. One of the big issues that kind of unfolded in this politically was the use of the National Strategic Stockpile. And I just, one of the question actually, one of the question that was posed has to do with moving the stockpile from the CDC control to, I guess, one of the assistant secretaries.
Yeah.
And do you think that created some issues in terms of how that was rolled out, or do you think it might have looked very similar either way?
Well, I think it was a brilliant move by Assistant Secretary Cadillac and the Secretary to move that stockpile from CDC to control of what's called ASPR, the Assistant Secretary for Preparedness and Response. Dr. Cadillac is a former Doctor Air Force, and he's, he was instrumental in really helping run this from a public health disaster response. So the benefit of moving that, transitioning that, is that CDC, when you get into HHS, you definitely see different viewpoints of what each agency views and how they view the world. CDC very much views the world through the CDC viewpoint, which is public health, tracking and tracing, but they don't have, honesty, a very holistic perspective, whether it's the economic, whether it's CMS, FDA, NIH. So moving the strategic stockpile, which has multiple components in terms of where it fits the best public health need, where it fits the best economic need, where it fits the best hospital need, to an agency or to an assistant secretary who has more of a global viewpoint, it was actually very important. And I think it was actually beneficial as we went through this process. Now, there was a lot of conversation specifically around, what was in the stockpile, whether it was adequate enough. And I think you can have some great conversations about what the last administration and even our administration had done to that point. But giving it to ASPR actually made a lot of sense, because it allowed for more viewpoints to have their thoughts heard as they doled out the specific uses for the stockpile.
In terms of the stockpile, I mean, one of the big conversations that's unfolded, and it's kind of related to a couple of the questions here, has to do with some of our dependence on imports for many of those assets. Do you see a realignment in terms of setting some of these aside as national security goods and making sure production is onshore? Or do you think we will return to the sort of, cost-driven world that we were in before?
I don't think you go through this and then you have, I think you have some significant changes that kind of derived from something like this. So I think in the immediate, you probably have a shift towards ensuring that the stockpile grows and is coordinated, and our manufacturing has the ability to basically take care of the United States. But as you kind of get further away, we talk about how these things happen once every 100 years. It would be interesting to me to answer that question about 15 years from now. And see, yes, we restock back up, but as we see deficits increasing, as we see the debt growing, whether or not the dedication to continue to invest in something like that, when you could get potentially efficiencies doing it other ways, I think that'll be a really interesting conversation. But I think you're going to see something very similar from a congressional oversight perspective after you saw 9/11. You're going to see essentially a panel convene specifically on understanding what happened, why it happened, and how we can get better, similar to how they did the intelligence side after 9/11. So I'm guessing in 2 to 3 years, we'll probably have a pretty comprehensive and interesting document that will detail how we could have done better, really Monday morning quarterbacking this entire instance.
In terms of rollout on this, do you think there need to be national standards? For example, in the response to COVID, there's been setting some national standards on sick leave and things like that if you want to participate in the bailout monies. And so one question becomes, do you think we need to have kind of federal roles for guaranteed sick leave going into the future?
Well, what's interesting about that is that's actually been a priority of the White House's for a while. I mean, you had the Family Paid Leave Act that originated, and that was actually spearheaded a lot from Ivanka. So that had been a significant priority of the president's and his administration to push that forward. I know they did that specifically, the FMLA, they plus that up for the federal workforce specifically. Now, I do think that you probably want to have a conversation with kind of your national chambers to understand the economic impact of what that looks like on your state and local. I don't think a federal mandate necessarily makes a lot of sense. I know that's typically what the federal government does a lot of times with this bailout money. If you look at TARP and some of the past ones, is they add a lot of stipulations about, things like executive pay or other, like in this case, you could conceivably do that under, as a stipulation for, getting some sort of this money from the CARES Act. But I think instead of necessarily looking that as a mandate from a federal perspective, I think a pretty intensive conversation should happen first with the chambers. And then maybe the governors as well too, to understand the consensus, because something like that, in addition to an already difficult economic period you're going to see for a lot of these service organizations that have suffered greatly, adding additional mandates on top of it, that could really restructure their ability to continue and operate as well too.
Thank you. A couple questions here about testing in terms of, do you have a guess on rollout when we're going to have the kind of capacity and infrastructure that we can get a sense of what the infection rates are and who can return to the workforce and who can't?
Well, it's interesting. Mayo Clinic yesterday came out, and I believe they said something along the lines of, we feel confident in our ability to test Minnesota. And that's the first I've heard nationwide of feeling like folks have the capacity to do it. Really, it's going to be important because right now testing is sometimes taken 4 to 6 days in order to get responses back, whether positive or negative. Once we get into the world where you have rapid, I still call them rapid strep tests. They're not for strep, but you have the rapid tests that have that can get you responses in 15 minutes. Once that one's being done, I believe, by laboratories. Once you get those done, you have the ability to quickly turn. What's interesting now is you're starting to see, I think the role of testing in this might conceivably also fall into businesses in a way that it hasn't in the past. I saw an article today specifically about the airlines looking at doing this, testing passengers before they get on planes. And typically, for complex testing, you have to fall under some interesting guidelines. It's the CLIA law, CLIA, that you fall under to get authorization to do that. So if you see kind of rampant testing and a move towards allowing businesses to do some of these 15-minute rapid tests, you could have the ability to do stuff as well too. Dr. Fauci, who I would recommend, he's one that you should all pay attention to and watch, as he's a leading indicator on kind of where they're going from the science and public health side. He gave some very interesting commentary around sports and when sports will return back to normal, and the efforts that should be done to essentially do things like, Major League Baseball or the NFL, and how sometimes fans are involved, a lot of times they're not, as we kind of roll through this. But at the end of the day, you really have three components. You have the ability to test and track and trace, meaning if we find someone's positive, to quickly trace the 5 to 7 people that we think they might have passed it to. The second is the therapeutic. Once we get a therapeutic, they can actually knock this down somewhat to like a Tamiflu. That will be significant. And then the third is the vaccine, when you talk about developing what's called the herd immunity, and making sure that a significant portion of the population, and this becomes really a seasonal, more like influenza type thing, as it is to a completely brand new disease that we're not accustomed or used to.
What do you see as the barriers to developing that kind of herd immunity where we just, this fades into the background, kind of like H1N1 swine flu is the big flu this year, kind of like that one did after its time in the spotlight?
Well, I mean, I'm not as science heavy as I probably should be to answer this question, but that really focuses on, whether we understand the strains, and we've typed and crossed it to understand what the actual, if we understand if our vaccine is efficient or not. I mean, I think if you look at the flu vaccine, that ranges anywhere between the low 30s to the upper 40s, sometimes depending on efficacy, every year. But what that does, the flu vaccine doesn't necessarily stop you from getting it, but it limits your mortality and your morbidity rates. So you have that. What's likely going to end up happening is that you're going to have 2 or 3 or maybe 4 different types of vaccines that are developed in this process. And then really it's where the science shows you, where the science leads, whether or not one shows a better rate in, this specific demographic or another one. I think the quicker we can get there, the better. But again, you're also, you're talking about vaccines, you're talking about vaccine hesitancy, you're getting into a whole wild group of another type of public policy issues that will have to be overcome for some sort of large scale vaccine rollout of this as well too.
Do you see a return to the pre-virus normal? We were talking about it, kind of an exploding stock market and economy that's almost overheating in some ways, to almost a dead stop. And then, do you see a return to at least a normal mode of operation for the economy?
In all honesty, I think you're going to see such a significant shock in consumer behavior that's almost impossible. I think you're going to see, a lot of improvements. Like a positive to this is that every restaurant is now on DoorDash or Uber Eats. I don't necessarily need to go to a restaurant, in the near future, as long as they stay on there. So I think you're going to see some significantly different business models. I think large big box retailers, I think restaurants, I think events, a lot of things that drive, places like Las Vegas, they have some significant hurdles to overcome because they're entirely contingent on convention and tourism. Well, how do we feel comfortable flying on planes again? You're going to have to convince us to fly on planes to go to a place with a lot of other people. That's a huge shock in consumer behavior that I don't necessarily know if all industries are able to navigate through. And when you talk about the need for social distancing and things like restaurants, what restaurant can really, in their business model, take off, 40% of its revenue to equally distanced tables 6 feet apart? Well, they do that by delivery and takeout. So that's going to change their whole model and their staffing, which from an employment standard, who's tipping anymore? Are you tipping the DoorDash driver? So you're going to have this influx and change in kind of the workforce as well that flows with this too, because a lot of businesses are going to see some efficiencies where they haven't had the willingness to necessarily take in the past. You're going to see a lot of businesses make more difficult decisions, and a lot of those tend to be on the workforce side. So you're going to see a probably pretty significant workforce change between now and whatever this new normal is.
So That's kind of a sobering response in some ways, although one of the things I appreciate about the market and the economy is it finds a way forward to respond to whatever people's preferences are at the time. A couple questions on the political side, just to kind of throw ourselves back in the political mess. One of them is the World Health Organization and the rift between the administration and the World Health Organization. Any observations or thoughts on that and how it can be better, I guess, improved going forward?
Well, it's interesting because the World Health Organization, at least from an HHS perspective, we tended to get along with them okay when I was there. What's difficult about it is that, and not a lot of people have really tracked this story, but my boss, Admiral Giroir, was actually nominated pretty early on in his tenure in 2018 to join the executive board of the World Health Organization, and he was blocked by Democrats for political purposes. So the US really hasn't had a voice on the executive board because, similar to the nomination process, an already nominated assistant secretary who in the past, the CDC director, flew through on unanimous consent, they blocked him from joining the World Health Organization. So we really hadn't had a voice at the World Health Organization. It's also something where the US pays a disproportionate share, as we do with other large international organizations. And sometimes you can make a pretty significant argument about what our return on investment is when we're fronting a majority of the costs. So in this, I think you have, you kind of have the return on value, which is very much how this administration views a lot of things. But you also have some distrust because, whether you trust the data coming out of China, which I don't think anyone should, or whether you trust, the data coming from the World Health Organization, or how much we understand how China influences the World Health Organization and others. I think there's a lot of stuff to be looked at that I think the president's move to do that makes a lot of sense because it really brings them to the table because they need us as a partner because we're a significant investment, financial investor in them.
Mm-hmm. And I think there's no other time in world history where a coordinated international health effort can benefit everyone. On the same political thread, there's two other sets of actors, and I was debating whether to go negative or positive first. I'll go negative first. Comments on the role that the media has played in the response. Do you think the media has in some ways helped or hampered the nation's efforts to confront this disease?
Well, I'll give you my administration answer, and then I'll give you probably more of an objective answer. The administration answer is you should watch the 5-minute video the president played, I believe, yesterday, that it basically showed that while they all critique him for slow playing the pandemic, they did the exact same thing. And he basically made them all watch it in the press room, which I found was, it's at least good TV, whether you agree with it or not. So some of the articles that I would point everyone to, Ari Fleischer, the press secretary for GW, wrote a really interesting article about how the press, if they took the same approach today as they did in World War II, how they would have reported D-Day. And I think you see the press's overwhelming insistence on going negative and specifically highlighting everything that's done wrong. One of the kind of the anecdotal evidence that I'll give is that when I was at HHS, they were reporting on us every single day. And at least for me, they were getting about 40% correct, and conjecture was about 60%. And this would be actions that I was taking or my colleagues were taking that I had firsthand knowledge of. And so I think there are a lot of them that do a good job. One of the best out there is Axios, AXIOS. That would be a source that I think does the best in understanding and removing their biases from their reporting. But I think a lot of the other sources tend to want to create their own narrative themselves, and that goes on both sides of the aisle. I won't say it's a left or a right thing. Both sides are equally to blame in this, but I do think that the alarmism or the non-alarmism or whatever point in time, they're always easy to criticize the administration for doing something that they are also doing as well.
And then the positive, and I think there's been at least a few hints of this, which has been a nice change from the last 2 or 3 years. What role do you think bipartisanship in the legislature has played in this, and do you see it continuing going forward?
Well, I know the president's panel to reopen the world is very bipartisan. There's a lot of critics on there that are generally critical of the administration. Um, I think pragmatism kind of rules the day a lot when you come into situations like this. I know specifically in California, you guys are, and having been part of the California State Senate before, having been part of the Republican Party of California, I probably wouldn't have said this a while ago, but your governor's actually done an okay and pretty decent job on a lot of things. Now, when you get into civil liberties and some of the other things, I think I could still have some gripes around what he's done. But I think, his ability to work hand in hand with the president, where that ability would not have existed maybe outside of the circumstance. Governor Cuomo and the president, also kind of working better than they have in the past. I would actually argue that it's the executive side or the executive branch side of are tending to work better with each other. I think the legislatures will remain the legislatures. They will use the partisanship of this to move forward. I mean, right now you have the gamesmanship in the House and Senate over whether to refund the small business plans because that money's starting to dry up. So you're still seeing similar arguments and battles from the legislative side. But I think on the executive side, the folks that actually have to act, I think they're doing a better job of kind of bringing their differences to the table for the good of the people.
Any prognostications about how this impacts the 2020 election?
Well, I don't remember the last time I read anything that Joe Biden had done. So I'm pretty sure that the president is still very well situated to win 2020. Again, I'm not going to prognosticate, specifically why that's the case. But if the economy comes back and is okay, I think that's a big indicator. Elections are run on the economy. I mean, and then you have some of the ancillary issues are outside of that. But given the leadership the president has shown, given the leadership that the agencies have shown, I'd be pretty surprised if he did not win re-election, especially given that you fundamentally haven't heard from Joe Biden in almost a month and a half. So I think the electorate will remember that. And I think the electorate will see how he is working on a bipartisan nature with the governors of things like California and New York to improve the lives of all Americans.
Do you think that when all is said and done, does this help his campaign or does this hurt it?
In all honesty, I see positives and negatives of both. From an economic standpoint, I mean, I think he was unbeatable with the economy where it was. I don't think anyone could have taken him on and won. With the economy in a difficult place, with about a 5 to 6 month lag between now and the election, there's still a lot of what ifs. But if we start to reemerge from this in early summer and we start to see a shift in the economy back to kind of opening back up and it wasn't as painful as we all imagined or are reading every single day, I think that is only going to help him. But also, I think, we don't know really what Joe Biden's going to run on right now, because I think there's a really big bifurcation of whether or not we go back to our kind of pure market, free market perspectives on how we're running the economy, or whether or not in 2020 the electorate wants essentially a government intervention because of this crisis. I really think that's the question of 2020.
Okay. One last question, because we're almost out of time here and I want to be respectful of everybody's time. Do you think that the government will be ready if there's another surge, say in August or September, if there's a second wave of COVID-19?
I mean, for how much resources, time, and effort we're dedicating to now, they better darn ready be. I mean, in all honesty, I have the utmost confidence. I mean, Dr. Giroir, who's running the testing side, which is a key component to this, is one of the most impressive people I've ever worked for. He is well positioned to do this. His team is well positioned to do this and lead based on the science in front of them. So I do think from the testing side, you're going to see significant capacity continue to come online. I also think the private sector will start to step up. And again, if we get some better definitions on therapeutics, getting those into the national stockpile, whether it's the hydroxychloroquine, whether it's the Gilead Ebola drug, I do think you'll have a lot of opportunities for the therapeutic side. And really, at the end of the day, it's going to be entirely contingent on state and local government. Can your local health departments track and trace outbreaks quickly enough in order to not have to shut down a significant portion of either your economy or your local area? So, I mean, really, at the end of the day, it's going to be a local government issue.
Well, I hope that you are right and that the feds are ready and that the state and local folks are as well. I want to thank you for your time. And one of the things that I'm constantly impressed by every time I get to speak to folks who step forward and serve in these high level positions in whatever administration it is A, the level of dedication, but also the level of thoughtfulness and effort that goes into these. And I just want to thank you for your time and for your time serving the public and the administration, and also for taking the time today. Like I said, one of my proudest things as a professor at Pepperdine is having alumni like many of those I see on the screen right now, but especially you able to come back and not only share with our community, but share with the nation as well. So thank you all for coming today. Again, check out our events on Friday, our seminar series. You can catch up. They've recorded the last 2 weeks. They run through the end of the month. And I look forward to seeing you all again at our next Pepperdine event. Thank you for joining us today.